Look, Victoria, in just about 6 minutes from now goes into new restrictions on the back of this latest outbreak. 9 people across 3 households. I sense this is a moment for Victoria to get back on track. Let's find out what Professor Peter Collignon thinks about this. Thanks for joining us again, Peter. We've seen the mistakes, we've seen the evidence, as you called very early on, that a lot of these lockdowns we've seen in the past were unnecessary, they were futile. What should Victoria do now with 9 people and 3 households and a known source of infection?
Well, they need to actually get lots of testing done of people in the region. They need to actually have people who are close contacts being quarantined and basically try the best they can to work out where this case is related to presumably the other case that came from Adelaide, because the genomic sequencing, I understand, is very similar or the same. But at the moment, there's really only one community case that's occurred where there's an unknown source. And this has occurred in a number of places before. And providing you've got very good contact tracing, cooperating public, you limit movements to some degree, like, how many people can come into the household, etc. You've all been able to get under control by doing that. And whenever they've had short lockdowns for 3-5 days, it really hasn't turned up more cases than good contact tracing and testing has done.
Now, the fact that we know the Valentine's Day weekend lockdown in Melbourne was superfluous, the fact that we know the same about the 2 Perth lockdowns and at least one of the Brisbane lockdowns, do you think this will give their public health officials and the government confidence to actually try and deal with this without going to that step?
Well, I hope so. I mean, if you start getting a number of, say 4 or 5 community cases completely unrelated, that may be a different issue. But Auckland has had a couple of lockdowns where it's made no difference. Adelaide has as well. So there's been about 8 or 9 of these over Australia and New Zealand. And as far as I can see, it hasn't turned up any more cases than were found by cooperative public, lots of testing, and people who are in isolation or quarantine anyway. Yeah, so well, hopefully this will be the case here as well.
Indeed, the Victorians say they're doing what you suggest, of course, isolating all the known contacts, getting lots of testing done. And it becomes a time situation, doesn't it? A number of infections. Of course, we all know if over a certain period of time you're getting lots of infections and you don't know where they've come from, then you're going to have to think about those more extreme measures. But what sort of time frame does the Victorian operation need to give this now if there's, if the increases are only in single digits over coming days?
Well, the sort of average incubation period is 5 days. So normally you'd want a 10-day to 14-day period where you're seeing it's all settling down and you're not getting new ones pop up, basically. So usually you feel safer or feel better after 10 days to 2 weeks. So we'll have to, I guess, see where that goes.
All right. Now, what about the mask wearing indoors? That's mandatory in just a few minutes in Victoria. A lot of debate about mask wearing and whether it's actually had a big impact on outbreaks overseas.
Well, I think masks do have a place. They're not the first line defence. I mean, the first line defence is avoid crowded indoor venues, particularly with alcohols. If you look where the outbreaks have occurred here and overseas, it's bars, restaurants, places where people are close together for long periods of time, usually without a mask because they're eating or drinking, and it's in households and in the workplace. But masks do have a place. If anybody's got infection, if they cough or splutter, then it goes less distance, so less people get infected, and also gives you some protection. Now, the protection level is maybe only 20%. So to put it in perspective, vaccines are much more protective, physical distancing is much more protective, keeping crowds down is much more protective, but it's another level you can do that for periods of time where you're not sure how much community transmission there is, wearing masks indoors makes a difference. I can't see wearing masks outdoors really makes much difference at all, almost any time. But indoors, in the places where you know it transmits more, it makes a difference. But you don't want to get a false sense of security. If you're at home and somebody's sick, you want to keep your distance from them. Yep. Rather than think if I wear a mask outside, it's going to protect me, or, when I'm going to the supermarket, etc. It's getting close to people, particularly people who've got any symptoms, is where you're most likely to pick up this infection. A mask, yes, might help as well, but you just need to keep the crowds down and keep your distance.
Thanks so much for joining us again, Peter. I appreciate it.
Thank you.
Professor Peter Collignon there on the situation in Melbourne and that advice. Let's hope that Melbourne public health officials and, of course, the people of Melbourne get on top of this one soon with social distancing, with those restrictions are in place and without having to go into any sort of a lockdown again. I know you people in Victoria have had enough of this. Hopefully it'll be put to bed in the next few days and you can have your footy on the weekend with crowds and all get back to something approaching normal.